Okay, welcome everybody to this session of the SASW conference. Welcome to John Trainer and to Sam King, who are going to lead the workshop. But before we begin, the name of the workshop is a strategic partnership approach to systems change for children and young people's mental health and well-being. And just as John mentioned earlier on to me, full disclosure, I was involved in this project at points. So I'm really interested to see how well it's developed without my influence holding it back. We'd ask you to keep your microphone on mute if you're not speaking, so we don't get any disruption during the workshop. And we are recording the session today, but we'll only be publishing the speaker, not any of the questions that are asked necessarily, but we will be reporting back on the answers to those questions in our report. We want you to engage as much as possible. So if you have any questions that you want noted early on, just stick them in the chat. I can raise them on your behalf, or you can ask them directly as we get to the question and answer session near the end. And I'll give a shout about 5 minutes before the end. So without any further ado, can I pass on to Sam, who's going to take us through this session. Thank you, Sam.
Oh, thanks for that, Frank. And afternoon, everyone. Delighted to be here with John this afternoon to speak to you about our workshop, which involves our work that started off back in 2019, as Frank said, quite a while ago. And we're going to spend the next hour or so looking at our strategic partnership approach between Barnardo's, Renfrewshire Council and wider partners, and really it's got a focus on systems change for children and young people's mental health and well-being. So a bit of a disclaimer from me, I've got a bit of the sniffles today, so if you see me sniffling my way through the presentation, John is going to jump in and just take over. So thanks. So hang on, just to set a bit of context to the work. So as I say, Barnardo's has been involved in this partnership with Renfrewshire Council since back in 2019, but really for Barnardo's, this work developed from our 10-year corporate strategy actually that was developed back in 2016. And really what we were looking to do at the time was looking to pull our resources across the organisation into 3 key priority areas over a 10-year period so that we could look to have significant change within those strategic priority areas, and mental health and wellbeing was one of those. So really the focus in that work was that Barnardo's knew that mental health and wellbeing for children and young people was one of the major public health challenges really facing the generation. Increasing numbers of children and young people, as we all know, being referred through to CAMHS for clinical supports. And it was creating a real bottleneck for clinical services, actually. And for those children and young people that required clinical services, they were on very long waiting lists. But actually, for a substantial amount of those children and young people that were being referred through to clinical services, they actually didn't meet the criteria for those services. And they were being referred through really as a result of there not being any sort of community-based interventions within local areas that they could be referred to as an alternative or much earlier on in that journey. So that was the focus really of Barnardo's work. And from that strategy in 2016, we developed 3 strategic partnerships with local authority areas across the UK. Our Renfrewshire Strategic Partnership, which we're going to talk about today, is our partnership here up in Scotland. We've also got a partnership with the local authority down in North Tyneside with a focus on improving outcomes for mental health and wellbeing. And then over in South Eastern Trust in Northern Ireland, we've got a smaller partnership that's got a very distinct focus around about infant mental health. But today, as I say, we're going to focus on our work up in Scotland and our work with Renfrewshire Local Authority. So really just setting some background now about the Mental Health and Wellbeing Core Priority Programme. So that's what the programme of work's called, that oversees our 3 strategic partnerships across the UK. So the real focus of that work was in systems transformation, with service design and prevention and early intervention at its core. We were really looking to develop place-based approaches to see what worked for children and young people's mental health and wellbeing. So we really needed to get an understanding of the local authority areas that we were working in an understanding of Renfrewshire and really what was working well in that local context in Renfrewshire and where we felt some of those gaps were in terms of service delivery, service provision, and children, young people and wider families being able to access supports. The place-based approach, it was really important that we used evidence-based or evidence-informed practice at least to inform how we would develop systems, services, pathways. And what was at the heart of that was looking at co-production with children, young people and families. That was key to the work in the mental health and wellbeing strategic partnership. We really needed to hear from children, young people and families, that experts by experience, what was working for them locally and what wasn't working, and actually to get that real understanding of what they felt would support them with their mental health and wellbeing. So really those overarching goals of the Mental Health and Wellbeing CPP was to be an agent for systems change. We wanted to be a facilitator for that systems change and to explore and support innovation through looking at new ways of working, so new participation, new collaborations across the local authority, and using that learning to inform how we would further develop the strategic partnership in terms of interventions, systems, processes. And then to look at that learning on the ground from what was working within Renfrewshire and to use that to inform policy and wider practice across the local authority and across Scotland and internally within our own organisation as well. So using that service design and systems thinking approach, and it wasn't just about Barnardo's and it wasn't just about Renfrewshire Council, it was very much in partnership with the NHS, with wider third sector organisations, community-based organisations working across Renfrewshire and others in partnership really with communities and children, young people and families to look to seek to explore, understand what was working really well, understand where the challenges were across that system and look to co-design, test new change strategies really within and across those systems. So that's what the focus of our work was really at the heart of that, was that co-production with children, young people and families. And we recognised as an organisation we needed to bring more than just investment from our voluntary funding. So this was more than just financial resource. It was also about people resource. It was about organisational resource. So we committed an input from various Barnardo's functions, and that was across our research and evaluation teams to support us to come in and do some of that work about what was working well locally and what was working well nationally. Our service design team to come in and support us to understand the views of children and young people, to understand how we could reach those children and young people within communities and that we could hear what they were telling us and that we could translate those messages back to our partners. We were looking for support from our policy and influencing teams, and that's from Barnardo's and across the local authority as well. And really what we wanted to do was work in an evidence-based and an evidence-informed way as we were taking this work forward. So that's really what our commitment was within the partnership, and we got that commitment back from the local authority and from wider partners to that work that we wanted to take forward. We also recognised that to achieve systems change within these partnerships, that it takes time. It takes time to build those foundations, it takes time to identify where the gaps are, and it also takes time to test and scale what we were wanting to deliver. So we made a commitment as an organisation that we would provide that resource and that voluntary fund investment up to 2025. So we started off the partnership back in 2019, and Barnardo's are committed to a partnership with Renfrewshire Council up to March 2025. So our organisational approach to whole systems change, as I say, will be based on evidence. And what we wanted to make sure, these were the kind of fundamental building blocks that would underpin the work that we wanted to take forward. We wanted to listen to and work with children and young people and to utilise their expertise. We really recognised that children and young people were the best people in place to tell us what would support their mental health and wellbeing. And they were best placed to tell us what was working for them within the current systems and what wasn't working for them. They were also best placed to co-design solutions with us that we could test out across the local authority. As I mentioned earlier, we wanted to engage a full range of partners to help and support children and young people within these communities and their localities. So it wasn't about Barnardo's coming in to provide services. We could have done that quite easily. This was about engaging and setting the vision with wider partners across the local authority. So we spent quite a lot of time within Renfrewshire engaging with community-based organisations, big voluntary sector organisations, smaller organisations, really trying to kind of, I suppose, set the scene in terms of what we were looking to achieve as an organisation, but very much recognising that that wasn't something that we could achieve on our own, that it was very much involved in that wider voluntary community sector response, and that response across the children and young people's mental health system in Renfrewshire. So those wider partners, and that included education, it included NHS, it included educational psychology. It was a whole range of partners, children's services that we needed to engage and set that vision with. What we wanted to do was draw on our wide range of service delivery experience. So we have a lot of services across Barnardo's Scotland, even more services within Barnardo's UK, with a large amount of mental health and wellbeing services. And we really wanted to build on some of that learning we'd had from significant service delivery in those areas, which told us both what didn't work as much as it told us what might work within those local contexts. And we wanted to, as I said earlier, to make sure that we understood local populations of children, young people and families. So that was very much getting alongside those other organisations, getting alongside community groups, going out into the community and really understanding what was being delivered locally, what was working within that local context, and where children, young people and families felt those gaps were within that current system. So I suppose you're maybe asking, well, why a strategic partnership approach? What does that bring to the table? How does that make a difference to a normal partnership and a normal commissioning relationship? You know, what is a strategic partnership? Well, why it made the difference for us was it provided that opportunity to work jointly. So not only with the local authority, but as I said, with those wider partners. And it provided that space and that opportunity to explore things differently and to look at moving from a shift of just treating the problem to really trying to understand what the root causes were. So trying to understand and identify what those root causes were. And we knew if we could do that and we could address some of those root causes, then it would really help us to look at delivering better outcomes for children and young people across Renfrewshire. So that was why we were very much committed to a strategic partnership approach. It also provides that wider opportunity to work collectively with partners and develop solutions that are place-based. So that's what works. We couldn't just develop an approach that we could then fit across our partnerships in North Tyneside and Renfrewshire and across in Northern Ireland. We really needed to develop on the ground that place-based community responsive approach. So these are just the 5 principles that as an organisation we feel need to be in place for effective strategic partnership working. Again, I'll probably say it about 20 times during this workshop today. At the heart of all this work needs to be the voice of children, young people and families. That's really, really important. It needs to be there. And when I say the voice, that's not just about hearing from children and young people what's not working. It's about giving them the opportunity to voice what they feel could support their mental health and wellbeing better. It's about providing those opportunities for children, young people and families to be involved in the design and the development of solutions to meet children, young people's mental health. So that's about looking at opportunities to co-design and opportunities to co-deliver effective solutions. It's also about shared values, trust and vision. Between all the partners, everyone needs to be committed, and you really need to be prepared to have open and transparent conversations and approaches to the work that you're trying to deliver. You need to look at a shared level of commitment from the partners that are involved in terms of that ambition and in terms of aligned core priorities in achieving that vision. There needs to be a focus on systems change. So systems change lies at the heart of every effective strategic partnership. There needs to be, as I said, opportunities to co-design and co-produce new ways of working, and to create that's the sort of fundamentals that create that lasting and sustainable change. So systems change needs to be at the heart when we're developing strategic partnership approaches. And also we need to look at joint governance, accountability and risk sharing. There needs to be strong leadership and collaboration across all levels. And also that includes agreed partnership board membership to oversee the work that's taking place. So it was really important for us in Renfrewshire right from the start to identify the correct people across that children and young people's mental health system who needed to be part of that governance board that was going to help us create and disseminate that vision. And we have a strategic governance group that meets regularly in Renfrewshire. John chairs that group and he has done since 2019. And we've got really good representation across the children and young people's mental health and wellbeing system. As I said earlier, that's representation from children's services, education, NHS and wider third sector partners as well. And we need to look at roles and responsibilities within that work because it's a very big playing field. So we need to look at specific areas of work and who has that responsibility for driving that forward and for creating that vision amongst their teams who are working operationally across that local authority area. And again, what's really important is agreement round about evidence and learning. And we agreed very early on across the 3 strategic partnerships that we needed an evaluation and learning partner. And we've been very lucky. Our evaluation and learning partners, Mental Health Foundation and University of Strathclyde. And really what they bring to the table is not just evaluation, but they're very much a critical friend in that process. And because they're overseeing the evaluation across the 3 sites, they're really able to bring that strong evaluation learning for us to share across the 3 partnership areas about what's working really well, about where the similarities are, about where the gaps are, and using that learning across the partnerships to look at how we can implement things differently. So we've been very fortunate in that respect. So in terms of Renfrewshire, the Renfrewshire Strategic Partnership didn't just appear out of thin air. Bernardo's has got a very long-standing service delivery relationship with Renfrewshire. So we've been delivering services in Renfrewshire for a number of years. And why we approached Renfrewshire about partnering with us to take forward this work was that we knew they were open to looking at doing things differently. We knew they wouldn't be afraid to identify and actually where they weren't doing things particularly well, where improvements could be made, where they had maybe not delivered things as well as they should have done in the past. And we were actually building on a number of work that had taken place over the previous years, where Renfrewshire had really been looking at the challenges facing the mental health and wellbeing of children and young people across Renfrewshire. So John, I don't know if you want to speak a bit about the work with Dartington that had taken place across Renfrewshire, because that really formed the basis of some of the work that we've built on from the strategic partnership.
Yeah, I will do. Thanks, Sam. And I think Sam's already highlighted a number of the reasons that Bernardo came to Renfrewshire. Way back in 2010, the Renfrewshire Council started work with an organisation called the Social Research Unit at Dartington, who later became the Think Lab. And what they did was they came to Renfrewshire at our invite and undertook what we called a large epidemiological study of children's need in Renfrewshire. And that was because we were a bit concerned about the number of children presenting to social work, the number of children who appeared from nowhere presenting to social work for services in distress, displaying distressed behaviour, displaying trauma. And we were trying to plan our services in a slightly different way. We analysed the information from a very large survey of over 12,000 children and young people. That was almost 95% of every child aged from 8 to 17 within Renfrewshire who'd completed an online survey. And that gave us some priorities. One of those priorities was mental health and wellbeing. So we decided that we would continue that work with Dartington. we started a project with Dartington called Early Systems Change, and at the same time we then had this invitation to consider becoming a strategic partner for this work with Barnardo's. And what was unique about this work was Barnardo's offered Renfrewshire some additional resource, but they also said it's not to the council, which was actually great. They said it's also not to Barnardo's direct, it's to the Renfrewshire community, and we'll talk a wee bit more about that as Sam goes forward. But what they also bring, built on that strong partnership of service delivery over many years, was challenge to Renfrewshire. And Sam's right, we are a local authority. If we do things well, we will celebrate it. When things don't go quite as well, we will look to see what learning there is and to use that learning to change. And I think that's one of the key things about a strategic partnership, that you enter it voluntarily, that you agree openness and transparency, and that you agree it will be learning to facilitate improving lives for children and young people. Later on, we'll talk a wee bit more about the direct impact on social work services, because there are many social workers obviously in the room today, and we'll talk a wee bit about that. And as a social worker and head of service and chief social work officer, this partnership has given me a degree of freedom that probably lots of other services don't have. So we'll talk a wee bit more about that as the workshop progresses. Thanks, Sam.
Thanks for that, John. So yeah, just in this slide, so here we are in Renfrewshire. This was us, this was some of the work that we'd undertaken in the very early, what we called was the discovery phase. And as John said, we were very much building on all of that significant work that had taken place with Dartington. So we had a real good basis to build on. And what we did, and we very intentionally did, was we started off this discovery phase with children and young people. So we weren't interested at this point in what strategic managers were going to tell us what was working well within Renfrewshire. We really wanted to hear that from children and young people and families. And that was children, young people and families who'd both been in systems seeking out mental health supports, but had also been children and young people who'd never come into contact with systems yet, who maybe didn't at this point have any mental health and wellbeing needs, or were identifying as having any needs. And what we were looking to find out was, and we ran a series of events across Renfrewshire, was hearing what worked well. So what worked well for children, young people and families? Was it particular services? Was it relationships with peers? Was it particular interventions in school? Where did they feel the gaps were? But we also really wanted to hear from children and young people, what did they feel would make mental health and wellbeing better in Renfrewshire? So really to get an understanding of if they did require support at some point in the future, or for those that did currently, what did they feel would help their mental health and wellbeing? And the children and young people were really vocal, and why we started off that process with children, young people and families was that we knew by the time we got to speak to strategic managers, we had a whole wealth of evidence there that we could, as John said, challenge and critique some of where strategic leads felt that resource should be allocated across the local authority. So we followed that process. As I say, we had quite a number of big events, but we also went out to groups to engage. So we went out to schools to engage. We went out to groups of young carers to engage with them in their own settings. We went out to speak to young people who were accessing drug and alcohol supports, young people with disabilities. So that work took place over a couple of months. And then we followed the exact same process with practitioners. So those who were working on the ground across Renfrewshire. So that might have been a number of social workers, a number of teachers, there was a number of housing support staff. And we went through the exact same process as we had facilitated earlier with children, young people and families. So again, we wanted to understand, and we were looking across the lifespan. Where did we feel there was really good interventions? Where were the gaps across Renfrewshire? What worked well? As I say, was it services? Was it policies? Was it particular relationships between organisations? And then finally, we followed that process with strategic managers. And as I say, we had some really robust feedback and evidence from children, young people, families, and those working on the ground to be able to challenge some of those views across the system. Because as you can imagine, across a local authority within the children and young people's mental health space, there's a lot of competing agendas in terms of where the resource should be allocated. So we were able to unpick some of that. And we worked alongside our research and evaluation team. Moved on to it. Worked with our research and evaluation team in Barnardo's and our service design team to be able to capture some of those insights about what children, young people, families, practitioners and managers were telling us. And this just a screenshot. This was from one of the sessions that took place with some young adults and young people across Renfrewshire who were very much telling us about their experiences of parts of the system that they'd accessed, what had worked and really what hadn't, and where they felt the challenges were to accessing support. So then we had all this wealth of information, and what we were able to do was get our service design and research and evaluation team to collate those into insights. So we had a number of different insights from all the consultations that had taken place. And what we did then locally was we invited everyone back to an insights event, and we fed back what those insights were. And we asked people, have we heard you correctly? Because we didn't want to presume what we had taken and produced into these fancy looking documents was actually what young people and families were telling us. We wanted to unpick that a bit more. We wanted to really understand if, we were hearing that waiting lists for CAMHS were a challenge. Really, what was underpinning that? Really, what was it, the struggle? What did children, young people feel and families feel was at the crux of that, and what might make that better? So we had a feedback event, and it really gave us some detailed information. And then what we did at that event was we got people to prioritise where that resource should be allocated. So that was really giving power back to those young people locally and those families locally, and those practitioners working on the ground to say, here's where we feel that investment should go across Renfrewshire. And we came out of that session and it was identified that we would focus our resource within the strategic partnership across that 5 to 15 age range. So that's where people felt that most work was needed done locally. And I should say, so the Renfrewshire Strategic Partnership, really the focus has always been, as I say, in line with our wider work. It's a focus around about early intervention and prevention. So it's really looking at how do we provide a community response across that tier 1 and tier 2 space for children and young people. So looking at that prevention space and looking at that early intervention space, and looking also at how that tier 2 community-based space interfaces with tier 3 provision. So if children and young people are accessing supports across tier 2 and their mental health needs increase, how can they access support within tier 3? And subsequently, for those children and young people who might be accessing support in tier 3, how do they step down into that community-based tier 2 supports for that ongoing support to their mental health and wellbeing? So this is our theory of change that we developed in Renfrewshire back in 2019. And we developed this with partners across the system and also with involving children, young people and families within this to agree what our priority areas were across Renfrewshire, and then what was the long-term outcomes and those midpoint outcomes that we were wanting to achieve to work towards that wider system change goal. And as I say, that partnership includes community-based organisations, it includes voluntary organisations. And really what we were looking to develop across Renfrewshire was a number of different areas of work with a focus on developing new pathways to support locally. So really looking at how did families, children, young people navigate around those systems in Renfrewshire to access support. We wanted to look at increasing those community-based interventions, so that tier 2 support locally. And we also wanted to look at how did we build the capacity of professionals to be able to respond to children and young people's mental health needs, because through the consultation process, really what children and young people were telling us were they wanted to access support from people that they had pre-existing relationships with. So how could we build the capacity of teachers in school, of social workers, of community-based wider organisations, voluntary sector organisations, to be able to respond appropriately for the needs of children and young people. So that's really what we wanted to focus on. So we're going to look a wee bit now at how that looks in Renfrewshire. And what I will say to you in terms of Renfrewshire and systems change in action, this is just some examples of the work. There's numerous work streams taking place in Renfrewshire currently, but there's a key focus on those 3 areas. So it's really about building that capacity in the system, about testing new ways of working in the community, so on the ground, and then looking at peer supports and co-production, because that came out really strongly from what families were telling us. So some of what we've taken forward across Renfrewshire, we've got a number of psychologically led interventions that we decided to focus on building the capacity of the workforce. So what that meant for us was bringing that voluntary fund resource. We were able to buy in access to training in these programmes and then offer those out to the workforce across Renfrewshire. So we were able to offer that out to any practitioner that wanted to access those, that then they could be delivering these supports within the community, and we would have oversight at the level of support that was being provided and know that it was appropriate to meet those mental health and wellbeing needs for children and young people. So some of what we've funded to date includes non-violent resistance. So it's a relationship-based approach to address distressed or distressing behaviour in children and young people. And the approach we've taken in Renfrewshire to that is it's 3-pronged. So we very much look at training professionals in the approach. We then look at delivering parent groups across the local authority for parents to access. And we've also been looking at whole school approaches as well in terms of rolling NVR out across that whole school system. We also funded LIAM, which if you don't know, it's Let's Introduce Anxiety Management, and that's a CBT intervention for children and young people experiencing low to moderate anxiety. So it's 6 sessions, a CBT, and that's currently being delivered by a number of HomeLink workers. We've got Families First team in Renfrewshire who are delivering that, and some third sector organisations as well. Empowering Parents, Empowering Communities is another one of the interventions that we've brought to Renfrewshire, and actually Renfrewshire is the first site in Scotland to deliver this programme of work. It's overseen by CAMS, but it's very much a peer parenting programme, so we train parents to deliver the group programme to other parents across the local authority, and that's, although in the early stages, it's having some really effective results and really effective feedback from parents. And then video interactive guidance. So in terms of testing some new ways of working across the local authority, and John will want to jump in here because part of this involves our partnership with social work, but we developed a new early help partnership. So it's a partnership between Barnardo's and social work, and really this was after quite a lot of analysis in terms of referrals that were coming through and presenting to duty social work, and they really weren't meeting a response. They weren't meeting the criteria that should require a response from a duty social work team. But you could very much, when you were looking at the referral, the families needed that earlier intervention, they needed that earlier help. So these were families that were trying to navigate their way around about the system and weren't able to access appropriate supports. So as a test of change and in partnership with 2 duty social work teams across Renfrewshire, we piloted this approach for these referrals that were coming through that didn't meet that statutory response, but that kept presenting at duty social work. And what we did was we would go out and offer a very short-term intensive package of support to that family to help them with those identified needs. And we're still in the early stages of that. We launched that last year. So we're very much working with Mental Health Foundation, looking at the evaluation round about that project just now. But there's been really good engagement from families, very good engagement. As I say, it's time-limited support. It's for up to 12 weeks. It's intensive support, and the families identify those outcomes that they're really wanting to work towards. John, do you want to say anything on that pilot?
Yeah, thanks, Sam. I mean, I think this was one of the things that was quite unique. As we started to review the role and function of social work. We asked ourselves some questions about, do we build dependency? Do we disempower parents and families from being in control of their own life? So we revisited some of those early principles of what social work's about. And we decided that we needed to do something that was a bit different, that actually took people out of systems entirely, gave them the opportunity to make the changes that they wanted in their lives at a pace that was supported, but was also quite tight in terms of intervention periods. And actually, we've seen some very, very positive responses there. And that was partly what we looked at in the past, was families who came to social work's attention. And because we're all busy in social work, we actually say that there's not an absolute need now. But if you go back to that early bit of social work training, what's the principle of the person presents at the agency with a problem? You're actually trying to find what's the underlying problem. And we weren't getting to the underlying problem often, and folk would then get a total, you don't require a social worker, and then 3 weeks later they'd be back with another issue, and then another issue, and then another issue. So this actually allowed us to work with Barnardo's in the Paisley area, and we extended it to the whole of Paisley area, which is our largest town, to say actually working with families. They've identified a particular number of key areas that they want to work on that don't require a social worker, but require a little bit of additional support to allow the parent or the young person to take back control of their lives. And from that, we've seen some really, really positive responses where people are not representing to social work in the way that they had previously. So it was about building capacity within the community. It was about building capacity within families, and it was about building capacity within individuals. And it was around the area of mental health and well-being. And that was partly because what we've seen, I think, through the pandemic and post-pandemic is this growth of everyone deciding there's a mental health issue, when in fact it's not always mental health, it might be a well-being issue, and that with the appropriate intervention that services could step back, but also because families in particular were waiting for access to CAMHS, where they thought that was going to be the panacea, it was going to be the silver bullet that would resolve all their issues, and we knew that wouldn't. CAMHS was never going to be the solution for so many of these families. So that structured, supported intervention from Barnardo's staff has made a tremendous difference and has given families control back. It's helped parents feel confident in being a parent, and it's helped young people recognise where they're distressed, how they can manage their own behaviour and support, and where they need further intervention, then they can get that, but on a planned basis. So we've seen that as being a very successful programme today. Thanks, Sam.
Thanks, John. Also, as I've mentioned earlier, we've been doing a lot of work to look at how we develop pathways to supports across Renfrewshire. So looking at the system, knowing how challenging it is for families to be able to navigate round about that system, to be able to access the most appropriate supports. We're looking at how we collaborate together across the system. So how do partners work better across the system to develop those pathways that families, children, young people and wider families can access and navigate the pathways to the appropriate supports in terms of their mental health and wellbeing. We've done a piece of work in collaborative commission with the voluntary sector. So we used some of the Barnardo's funding for not only the wider voluntary sector and community groups to access training to be able to deliver it across Renfrewshire, but also to fund them to deliver that training. Because it wasn't just about being able to access training. As we know, coming from the voluntary sector, a lot of the time you can only deliver what you're commissioned to deliver. So again, we used some of that funding to seed fund wider organisations to roll out those interventions across the local authority. We've also had the Shout Tech service, which has been rolled out across Renfrewshire, and the Rent End Digital Hub, and I'll show you a picture of that and speak to you a bit about that on the next slide. And then in terms of peer supports and co-production, Honest, Open, Proud, so the HOP programme. So this is a programme that has been developed and brought over to Scotland by the Mental Health Foundation, actually, with a focus on adults and looking at stigma and disclosure around about mental health. So we've worked with a group of young people in Renfrewshire who have co-developed the programme for delivery with young people across Renfrewshire, and they've been delivering those sessions, rolling that programme out. So very much young people, supporting other young people to look at how you might want to disclose and talk about when you have a mental health need, and how you might do that within a way that you feel safe and supported and at a pace that feels comfortable for you. We've also rolled out the Together All digital peer support as well. So that's a digital peer support offer available across the whole of Renfrewshire that young people are able to access. And then EPEC, Empowering Parents, Empowering Communities, as I spoke about earlier. That's group work for parents delivered by parents, and the early feedback from that programme of work has been extremely positive. And as I say, that's quite a tight fidelity around about that programme, and it's monitored by CAMHS down in London. So we've been really fortunate being the first site across Scotland to be rolling that out. So the Ren 10 Digital Hub that I was speaking to you about, that's just a screenshot of the new Ren 10 Digital Hub. And really what we wanted to do, this is the first iteration of the hub. So it was really about, we were funding, working in partnership, rolling out a range of interventions across the local authority in Renfrewshire, but how were people going to know about them? So how were young people going to know, how were families going to know, and how were other practitioners going to know what was available for families that they may be working with? So it provides us with a digital space that we can house that information on. It can be accessed by families, it can be accessed by professionals, it's broken down into age group, and it enables practitioners and families to know what's available locally and to know the pathway to be able to access that. So can they self-refer into that? Do they need to be referred by a worker? And a bit of detail around about what that intervention is like also. And what I should say in Renfrewshire, is we've obviously been really fortunate with the work that's taken place and been able to build upon that as well. As you'll be aware, there's been a number of different funding streams that have come into local authorities across Scotland following 2019 and the development of our strategic partnership. So we've had the Scottish Government funding for community-based children and young people's mental health and wellbeing supports. We've had the whole family support funding that's come out from the Scottish Government. And what this approach, what this partnership has enabled us to do with the people that we've brought together across the system is to align those funding streams, because quite often what can happen in local authorities, as you will well know, is numerous funding streams come in and they're overseen by different parts, different areas and different committees within the local authority, and there can often be duplication and then significant gaps in terms of delivery. So what we've been able to do in Renfrewshire is have oversight of that to make sure that there's no duplication and that we can build on what's working within Renfrewshire. And it's also allowed us to increase the initial age range that we were looking at supporting, which was that 5 to 15 through the Bernardo Strategic Partnership, right up to age 25 in Renfrewshire. So it's enabled us to look at that 16 to 25 age range and what supports and interventions are needed for young people's mental health that sit within that. So just moving on now to look at our evaluation and learning. So as I say to you, we have a partnership with Mental Health Foundation Scotland and the University of Strathclyde, who have been our evaluation and learning partner across our 3 sites in the UK. And really what the focus for us as an organisation, really what we wanted to know and why we wanted to bring in an evaluation partner was really to understand what was the added value of a strategic partnership approach facilitated by the third sector to improving children and young people's mental health and wellbeing. So that's the overarching evaluation question for us as an organisation that's brought both resource and voluntary funds to these partnership areas. And really within that, it's the evaluation's broken down into 3 sub-questions for us to really understand what the nature and role of strategic partnerships are and what the barriers and enablers to the functioning, to understand what the impact of a strategic partnership is on that wider system, supporting children and young people's mental health and wellbeing. And finally, to understand what is the impact, or is there an impact of a strategic partnership on those end user beneficiaries, so on children, young people and those wider families. So has it made a difference? Has there been an impact? And if so, what has that impact been what's worked and what's not worked. And really through our very early learning and setup, and I've spoke about these within the strategic partnership principles, it really became evident these were some of the important factors that came out in terms of that successful strategic partnership working within Renfrewshire, and those align back to those principles. So really having that representation across the system, making sure that people were clear in terms of their role and remits of partnership, making sure that the voice of children, young people and families was central, and maintaining that collective buy-in. So that was that buy-in across the system, not just at a strategic level, but at an organisational, a professional level, for those delivering on the ground, for those delivering in community groups, making sure that there was that buy-in. There we go. And some of the early learning that came out in Renfrewshire. So where we are now, we're evaluation and learning partner. We've had 2 evaluations, so a phase 1 and a phase 2 evaluation that have already taken place. Thanks, Frank. Sorry, I was getting a 10-minute warning there. So we've had, our phase 1, phase 2 evaluation, and really what those have been looking at has been what some of those enablers and barriers to strategic partnership working, to the setup and to the delivery of strategic partnership working towards systems change. And for us in Renfrewshire, some of those strengths where there's really strong relationships and established networks within Renfrewshire across partners, and we were really able to build upon those. So we weren't starting from zero. There was strong existing, as I say, relationships between organisations, good local knowledge of what was working, where the gaps were. So that really supported us in the initial phases. We really identified early on in the partnership, and there was agreement across all the strategic partners, that we needed a dedicated participation resource to really look at how we shifted from we design and they use, which was what, not just Renfrewshire, which is what is apparent across a lot of local authorities. So strategic partners, we design the services and then children, young people and families use those. So we really needed that dedicated resource to make sure that the voice of children, young people were central to all aspects of the process that we were taking forward in terms of systems change. John mentioned this earlier. One of the strengths was that Bernardo's were viewed to bring in challenge to certain ideas, and we'd done that a lot at the start of the strategic partnership. So when I say to you, remind you, we started off gaining the views of children, young people and families, and we'd done that intentionally because we wanted to challenge some of the perceptions and some of the views of where the resource should go at a strategic level. And that was a real strength, that we were able to bring that and we were able to utilise that as an organisation. And then there's been certainly a change in perception across Renfrewshire of Bernardo's from just being a service provider. So we'd had that service provision relationship for over 25 years, but there was a real shift in views that Bernardo's were bringing much more to the table than just being a service delivery partner. Some of the challenges, some of the early challenges we had was our steering group membership. So where should it sit? We had a mix of strategic and operational, and we realised quite early on that we needed that steering group to be fairly strategic in terms of setting that vision and being able to disseminate that vision to wider teams across the local authority. Co-production and consultation, again, in the early stages, it certainly was apparent that strategic partners probably felt that was something that Bernardo's brings to the table, and maybe not just Bernardo's, but that the voluntary sector brings to the table. So a lot of work has been done with partners, and you'll see later on in the evaluation, there's a lot of evidence to say that there's been a real shift in terms of the value of co-production within service delivery models across the local authority. I need to balance the development of collective buy-in to the work of the strategic partnership and individual organisational objectives and priorities. So, of course, as I said to you, when you've got that wide representation across the children, young people's mental health system, there's going to be a lot of different competing priorities. So social work's going to have a lot of different competing priorities from what CAMS has, and it's trying to negotiate some of that across that strategic partnership. Steering group structure, governance and accountability within the local authority. So that was one of the challenges initially, and that was quite quickly addressed within Renfrewshire to make sure that our steering group was accountable to the wider community planning partnership that sits across Renfrewshire. There was initial frustration with the timescales around the discovery phase. So some of the partners were slightly frustrated about why was the work not taking place a lot sooner. But actually that was the right thing to do. We really needed to hear the voices of children, young people, families and practitioners. And then confusion over Bernardo's role and Bernardo's annual funding cycles provided a bit of a challenge. So year in year we were having to confirm what the budget was moving forward for the next financial year, and that was one of the challenges to the work. Sorry, I'm just moving on. So some of the learning that's come out from our evaluation, there's been some key themes that Mental Health Foundation have pulled out in terms of some of the themes across the 3 partnerships. And this is what's going to inform our phase 3 evaluation. So that's our next phase of evaluation. So prevention, there's been some real early evidence of a shift towards the language of prevention across the Renfrewshire partnership, and evidence of prevention is central to the ethos of the partnership within the delivery of the early help interventions that's already been rolled out. In terms of sustainability, there's a focus not only in respect of individual programmes within the system, but also in behaviour change and prevention across Renfrewshire as well. So yeah, people are thinking about sustainability. How do we sustain these programmes of work, and what's the legacy as we move past 2025? Partnership working, that's come out really strongly in Renfrewshire. There's been increased collaboration across the system, and that's been in a number of different partnerships across education and CAMS, across Bernardo's and Children's Services social work duty teams. There's been numerous collaborations that have taken place due to the development of the strategic partnership. And co-production across partners. There's still challenges making sure that co-production with children and young people is evident in everything that we design and we deliver across Renfrewshire, although there has been a real shift, as I say, in that concept of we're not doing to now, but we're certainly doing with. So that's what people are speaking about, is doing with. And in terms of language, there's certainly evidence in Renfrewshire that we're moving away from that clinical mental health terminology, and what we're looking to achieve is a much more nurturing and emotional well-being and resilience language. And what's supporting us to do that is some of the training programmes that we've funded that's building capacity across that workforce. So we're coming from that point of well-being and not from that point of mental illness, and using that terminology with children, young people and families. And then evidence in the impact. So certainly more robust systems. We need to look at more robust systems across the local authority, and we're currently working on that. That's going to let us evidence impact over time, because we understand that when we're working towards systems change, that takes time. So we need to look at how we evidence some of that. And just very quickly, within each of those areas, and I've spoke about this in relation to Renfrewshire, some of those enablers that's really helped us and some of where the challenges have been, as I say, we've aligned funding. So we have that vision set. We've got that vision that's shared by partners across the local authority in Renfrewshire of what we want to achieve in terms of that systems change ambition. And we've been able to align funding to that from wider sources that's come into the local authority. In terms of sustainability, some of that building the capacity of the workforce to respond will help us in terms of sustainability post 2025 when the funding's no longer there. But it's also been about changing mindsets and across the local authority, as much as it's been providing opportunities for those new collaborations. So it's about changing mindsets of how we respond and how we design and deliver services for children and young people's mental health, and looking at that shared language. And as I say, some of that building capacity across the workforce has helped us to create that buy-in and to support that use of a shared language. And again, the medicalised language across many parts of the systems, it's still at odds with that strengths-based language. And we will always have that in terms of looking at how we negotiate that with health and how we can promote the use of that strength-based terminology across the local authority. In terms of co-production, as I say, there's been some really good evidence of that across Renfrewshire, across partners, and that very much that attitude that we're doing with and we're not doing to, we're not designing for, we're designing with children, young people and families. But we need to look past that it's just the third sector and voluntary sector organisations that do that really well. So we need to look at how we support our strategic partnership partners across the system to embed the ethos of co-production within their services. And then again, evidence and impact. What's really supported us is our theory of change. It's helped keep us on track. As I say, we developed that back in 2019, and very recently we revisited that theory of change. And that's about making sure that all partners across the system are bought in to creating that vision. And again, looking at that strategic partnership, and it's a two-way flow of communication between the strategic level, between communities and between evidence-based practice. And that enables us to do that in terms of that evidence and impact. And then the barriers, some of the barriers for us, and that's what we are looking at over the next 12 to 18 months is, again, it's easy for us to collect evidence at that programme level. So there's many work streams across Renfrewshire and it's easy for us to collate some of that programmatic level data. But actually, how do we evaluate that at a systems change level? So what impact has that had to the wider system? And we're looking at how we take some of that forward over the next phase of our evaluation. So just moving you on to the very last slide. So Renfrewshire systems change plans up to 2025. So what's the key priorities for us now? Well, as I say, we've got a number of work streams that we're delivering across the local authority, but we're still working with partners to identify where's the gaps. So we're really, we know where we've got to, but actually where are the gaps? Where are the children and young people and the families that we're not quite reaching? And we need to look at identifying that quite quickly between now and 2025. Working with partners across those work streams to plan for sustainability, and a lot of the programmes I work already have sustainability planning built into those, but we need to work to make sure that they're sustainable. So what we were very clear that we didn't want to do in Renfrewshire was create services that then come 2025 we could no longer fund. So we need to look at how they're sustainable and embedded across the system. And then very lastly, our phase 3 evaluation. So we're currently undertaking, looking at what the field work with children, young people and families will be to inform that phase 3 evaluation. So that evaluation for us is very much about what impact have we had to date, what impact has the partnership had, and how are we delivering in terms of achieving that wider system change ambition. And that's, yeah, thank you.
Yeah. Thank you very much, Sam. And a very comprehensive presentation. You've crammed a lot into the short period of time we've got. We've only got a couple of minutes left, so if anybody has any questions, please do raise your hand. I was actually going to ask you about the language, obviously being part of that process really at the very beginning and seeing how it's developed. I'm really interested in that transition into much more nurturing language as opposed to the kind of medicalised straight line thinking, perhaps. How challenging has that been?
John, you can pop in here if you want. I mean, I would say we've still got a way to go, but certainly from our last phase 2 evaluation, I mean, language has come out quite strongly as a key theme across each of the 3 partnership areas. But certainly within Renfrewshire, there's been really good evidence of quite a shift towards a focus of wellbeing. So starting off those conversations from a focus of wellbeing and not from a focus of mental health illness and that terminology when we're speaking about mental health and wellbeing. I think underpinning that, as I've mentioned, is some of the programmes that we've been rolling out across the local authority very much come from a point of wellbeing underpinned by trauma-informed practice, etc. So it's enabling a consistency of language when we are speaking about children, young people's mental health and wellbeing and wider families, because we know from the very onset, when we started that discovery phase, that was one of the key issues that children, young people and families were feeding back to us about mental well-being starting from a point of illness, and the language that was being used across Renfrewshire and wider, very much coming from that clinical terminology.
I think, Frank, the whole issue of language and whether it's empowering or disempowering, and I think particularly in the mental health world, we often use disempowering language because it allows either professionals in the medical health world or in fact in social work to exert control. So we wanted to challenge ourselves around that. It's not always easy because there are some people who remain very comfortable, who remain in clinical settings where they want to stick to particular language use. But we challenge that. We want people to make language accessible for young people. We want the language to be understood by families. So that was part of it. But we've also linked it to work that's extended from this programme into some of our work around the promise, and about, you know, where we're encouraging language change with our professionals, young people, families around the language for looked after children, for example. We're very clear about the language we're using there. Again, very much about empowerment language, taking away those negativity, stopping using acronyms where those were challenging for young people. So very much an empowering place. And I think talk about well-being rather than mental health. Mental health suggests deficiency or illness. Mental health talks about empowering families to be in control of what they want and how they resolve and how they manage their lifestyles that help them take control back from professionals. And that was very much part of the programme.
That's great, John. Thank you very much. And thank you both for your presentations today.